So I have this really clear memory. It was the mid-90s. I was in between jobs, and San Francisco's economy, or California's economy, was in a recession. So I was hanging out in my San Francisco apartment, contemplating life, thinking, maybe I could just avoid this whole job thing by doubling down on my student loans and hanging out in graduate school for a while. The only problem was I had no idea what to study. So being that it was the mid-90s, I grabbed the giant book of Yellow Pages, plopped down on my bed, and started going through it for ideas. I started at A for accounting. I figured that wasn't going to work. I kept going, and kept going. I got all the way to P for plumbing until I started getting worried that I was running out of letters in the alphabet. I finally turned the page to psychology, and I thought, okay, that could work. Maybe I could finally learn the secret to happiness, or at least have some fun learning how to diagnose my family along the way. Fast forward a year from then, I'm sitting in class in my PhD program, and my first assignment is to memorize an 8-pound, 888-page book on what's wrong with people, which was not what I had in mind at all. So even after training at some of the best institutions and going on to develop innovative programs for health psychology, or building a full practice, that viable approach that I was looking for to help my clients or myself achieve happiness still felt as elusive as ever. I was incredibly excited when the positive psychology movement started because it led to an explosion of wellness concepts. But even then, the bulging tool bag of techniques, it still lacked that simple, coherent, easy to remember, guiding principle for how to live our best lives. And then I met Sunny. She was leaning against the wall at a hospital cancer center, dressed in athletic gear. She was bebopping to the music in her headphones. At first, I thought she was one of those cheery bike messengers making a delivery, until she smiled and raised her hand when I called her name. At that time, I was directing a program that offered free counseling to medically ill and terminal patients at a San Francisco hospital. I was fresh out of my postdoc training with a head full of steam, and I had my mental disorder labeling guns ready. I was lethal in diagnosing anxiety disorders, personality, and adjustment disorders, so this woman's happy-go-lucky demeanor definitely stopped me in my tracks. It turns out she was receiving daily radiation for an aggressive form of cancer. She had no friends or family nearby for support, and she had caught the bus before dawn that day because she needed to be the earliest appointment so that she could make it back to work. I expected that in our session, she would naturally want to talk about how awful her circumstances were. But I was wrong. This woman, who I like to call Sunny, instead told me about how grateful she was for the kind hospital staff and for her employer's flexibility with time off. Still fixated on trying to diagnose her, I considered denial, and I challenged her directly about how she could manage to seem so lighthearted when she had so much going on. "What do I have to be sad about?" was her reply. Sunny admitted that, of course, she wished her circumstances were different. But she explained that she had already wasted much of her life feeling sad and sorry for herself about things that didn't matter, and that cancer had changed her. She could finally see what mattered. She could finally see how much she had, and she didn't want to waste any more of whatever time that she had left being resentful. I was speechless and in awe of how she could possess so much grace and contentment while she was dealing with so much. Sunny did go on, of course, to feel the full range of emotions, including grief and overwhelm. But what remained constant through it all was how grounded she was, how completely she was living her truth, and how alive she seemed while she was facing the very real possibility of death. At first, I thought Sunny must be a one of a kind. But we kept meeting other patients like her, patients from cardiac rehab, palliative care, even organ transplant. And these patients often reported feeling more like themselves than they ever had before and preferring this new version of themselves. They had clarity, they knew what mattered to them, and they were living in alignment with those truths. What we were observing in this particular subset of patients was more than just resilience or even contentment. It was something much bigger, something transcendent. In spite of their health challenges, these people were thriving. My colleagues and I were intrigued. We had never learned about this type of profound overall contentment in grad school. And we found ourselves describing these patients in very similar ways: awake, clear, engaged, intentional, emotionally honest. We started referring to these people as connected because it seemed like they had plugged into themselves, as well as to everything and everyone around them. Their example made me sit back and fundamentally reconsider my own approach to life. At the time, I was relying on sleeping medications to get me through my nights and coffee to get me through my days. I was staying in a doomed marriage and telling myself that I had my reasons. I was keeping my and my family's schedule filled to the brim, always on the go, eating on the go, barely sliding into home plate wherever I went. I was saying that I cared about things like the environment, but never bothering to recycle. I was letting dear friendships fade, always saying, let's get together soon, knowing that I would never follow up. I figured this was all just the realities of modern living, and probably as good as it gets. But I was haunted by my patients' inspiring examples. It hit me that they understood something powerful about the key to a life well lived. The word connected came back to me again and again, and I started to consider how life is really all about relationships, how we relate to each other, but also how we relate to ourselves, our bodies, our work, our communities, and how we relate to things like time, money, or our belongings, and how in order to fully inhabit our lives and appreciate them, we need to be examining and nurturing all of these relationships. What these patients knew how to do instinctively was make these relationships their priority. Strengthening those relationships was their paradigm for living, as if their brush with death had helped them block out all distractions in order to be able to see what mattered. Today, problems like major depression, attention deficit disorder, even erectile dysfunction get all of our attention. But the real, silent, everyday thief of joy in our lives is rampant disconnection. At the individual level, we see it all around us in subtleties, like the person that asks how you are, but doesn't care about the answer. Or in how we sleepwalk through our daily activities. We see it in families that sit silently at the dinner table staring at their devices. At the societal level, it's far worse. We see it in how the rise of anxiety, depression, and suicide have skyrocketed upwards of 70% worldwide in the last 75 years. Or how 1/4 of Americans say that they don't have a single person that they can confide in. We see it in the rise of consumerist culture, environmental destruction, political polarization, and mass shootings. Even though technology purports to connect us more than ever before, we are leading increasingly isolated and misdirected lives. When you think about it, nearly all emotional suffering in our lives grows out of some kind of lost connection. Lost personal connections, of course, but also lost connection to ourselves. to our values and our priorities, or lost connection to some kind of purpose in life, or to work that's meaningful. Disconnection has become the silent epidemic of our time. Everyone, including my earlier self, loves to think and talk about happiness. Whether we're happy with our lives, our jobs, our partners, and what we should be doing to get happier. But research actually shows us that the more that we pursue happiness, the less we end up experiencing it. Happiness is just an emotion, and a temporary one. I was searching for something more sustainable. I started to wonder if the better goal, the one that would lead to more enduring satisfaction or holistic well-being, was the connection that I first saw in my medical patients. I decided to use myself as my first case study for what I was beginning to think about as connection theory. At that time, I wasn't exactly sure what I meant by the word connection, but I figured I would know it when I felt it. So I started by just asking myself this very simple question: am I feeling connected right now? I asked it as often as I could, while working, while driving, while talking to a friend, at the grocery store, whenever it came to mind. And I was blown away by how often the answer was no. As an example, I was herding my kids hours out of the day from point A to point B, focusing on things like their compliance, being on time, or having a clean house. All of these activities, I realized, felt meaningless to me because I didn't truly care about the end result. What I truly cared about was having a close relationship with my kids. But you couldn't see that from any of my interactions. So I decided to start by building closeness instead of control. And I experimented with small changes at first, like walking and talking on the way to school instead of driving, or by cutting out optional after-school activities to create more downtime. I got better at putting down my devices and asking them to do the same. And I stopped rushing things like the bedtime routine to create more opportunity for real conversation. I had to let go of a lot of things that I pretended were important and get creative about finding ways to stay close, but it worked. These may not sound like changes of epic proportion, but tuning in to what built or blocked the connection in our interactions was the beginning of a better life for me and for my family, and inspired me to go on from there to deepen the connection in every other area of my life. Since that first big personal breakthrough, I've been experimenting with this technique in my clinical work. I've developed a theory about it, wrote a book about it, and I created a research lab so that I could begin to compare some of my anecdotal findings to actual scientific data. And we've discovered some really interesting things. First, connection seems to be something that people just intuitively understand. We were able to interview a large random sample of healthy individuals about the state of being connected, and they described their experiences in remarkably similar ways to our medical patients. Second, connection seems to be something that's really, really good for you. Our earlier studies enabled us to develop a validated measure of connection, and individuals who scored high on that measure of connection also scored high on objective measures of overall well-being, including flourishing, which is the highest form of well-being. Another critical finding from the lab is that nurturing connection is highly correlated with and naturally leads us to the things that we crave most as human beings: meaning, purpose, clarity, and belonging. And much to everyone's relief, you don't need a terminal diagnosis to overcome the disconnection of our modern world. Using convenience and snowballing sampling techniques, we were able to actually find and interview highly connected individuals in the broader community, and they talked about connection being an everyday practice. So you can see, what we mean by connected isn't just about interpersonal connection. It's about connecting with yourself, first and foremost. It's about waking up to what's meaningful to you and making decisions accordingly. If my 20 years as a therapist and a wellness researcher have taught me anything, it's that everything that we undertake in life succeeds or fails based on the level of how present, engaged, and committed we are to it. In other words, our level of true connection. To be clear, I'm not saying that connection theory is a magic wand or that it's humanly possible to be connected 24/7. But what I am proposing is a simple approach to greater well-being across all areas of life. It begins with opening your eyes to how you're living your life right now with a simple question: am I feeling connected right now? Am I feeling connected right now is like asking, am I focused on this activity or this conversation? Is it meaningful to me? Is it something that's consistent with my goals and with my values? Imagine for a moment, if you were living your life each and every day according to your highest values, what kind of work would you be doing? Who would you be spending your time with? What would you be eating, creating, or even revolutionizing? Connection is that one idea that can help us to change everything. So I ask you now, are you feeling connected? Take that question with you as you leave here today and let it change your life like it changed mine. Thank you.